Next, we're going to do an accessory motion assessment of the cervical and thoracic spine. So first, we're going to differentiate between the upper cervical spine. So we're going to start with C0, C1 joint. What you're going to do here is you're going to feel for the edge of the occiput and come just distal to that, just slightly, and you'll feel a slight ridge. And you're going to apply just a very gentle posterior to anterior pressure, assessing for pain or any reproduction of their symptoms or hypomobility. Next, you need to look at C2, C3. So what you're going to do is you're going to go just inferior to the C2 spinous process. You're going to come just laterally to that. And you're going to have just a slight medial or a 30-degree medial angle to check the left C2, C3 joint. Again, you're just going to kind of bring that tissue with you, just slightly lateral to the spinous process. Now to get to C1, C2, I'm going to have my patient rotate about 30 degrees to the same side that you're testing. So again, we're going to come off that C2 spinous process. We're going to be just lateral to it again, but this time it's going to be the C1, C2 joint because of the rotation component. And we're just going to glide a little, checking for hypomobility or pain. Have them turn left, same thing, C2, just lateral. As far as cervical central PAs, what I'm going to have my patient do is make sure that they're in a very neutral position, and I may need a pillow or something to keep them from extending that cervical spine. And I'm going to come down the spinous processes. So this is C2, we'll go down to C3. I'm going to bring that tissue up, get my arms nice and straight over it, and just provide a gentle anterior force on those spinous processes. You're going to work your way down. You don't want to impart so much force that you're removing other segments, so it's really very gentle. As you do UPAs, you are going to come just lateral along the articular pillars and follow those down. You're going to bring that tissue over to the side, about a 30-degree anterior but also medial angle as you move down. We'll do the same thing on this side. Slight medial angle. Not so much movement that we're inducing a lot of movement throughout the cervical spine. As you start to look at the thoracic spine, you want to be sure that you take into account the rib cage. So it's not going to be a true posterior to anterior mobilization as you move down. You're going to have to adjust. So in the upper thoracic spine, it's going to be anterior, but it's also going to be slightly inferior. And then as you work your way over, your glide is going to be a little more superior as you go over that. So for the central PAs, you're going to get that pisiform right on that spinous process and a slight inferior and anterior glide. And as you work your way down, be a little bit, the angle will be slightly less, and it'll start to turn into a more superior angle. Again, you don't want to induce so much movement that if you're inducing a lot, you're moving multiple segments. You really want to just see the ones that you are on. Okay. You can also assess with your UPAs, you can do the intervertebral joint as well as the costotransverse joint. So what you're going to do is you're going to come just slightly lateral to the spinous process. You'll feel a little gutter. That is your intervertebral joint. So you can do your UPAs here, again, getting that pisiform right on there. I'm going to have to be a little bit taller. Taking into account the same angle adjustment over the rib cage as you move down. Okay. And then as you work down here, it'll be more at a superior angle. Finally, your costotransverse joint is actually going to be just lateral to where you were. You'll feel kind of a ridge back up again. It's about 2 thumbs width away from your spinous process, and you'll feel kind of a ridge, and that's where you can then provide that posterior to anterior force. With all of these, you're inducing a bit more of an extension moment with their central PAs, and then a little bit of a rotation away component with your UPAs. So your costotransverse, spinous process, about 2 thumb widths over, you'll feel a slight ridge come out again, and then apply that force.